In tomorrow's business today, imagine a robot that allows doctors to beam themselves into hospitals to diagnose patients and help during emergencies. Well, it's a reality thanks to a joint project by InTouch Health and iRobot. They've created the first FDA-approved remote presence robot. Amazingly, it's all true, and here to tell us about it is the CEO of InTouch Health, Yulun Wang. Yulun, thank you so much for joining us. Okay, I guess before we get into how this works, how did you come up with this concept? And when I hear the word remote robot, and when it's dealing with healthcare, I really worry that you're not getting the face-to-face, even though it may be through a screen, that a patient may really need and want.
Yeah, well, first of all, thank you for having me on the show. And I think the reason that I got into this business is because having a healthcare background, the challenges of providing high-quality care consistently to everybody at a lower cost is one of the biggest problems the country faces, and being able to use this robot as a physician extender so that the right expertise can be at the right place at the right time to do the right thing, that really does it. It improves quality at a lower cost, and so that's why we did this.
Now, these robots, as we can see, we're rolling the videos, we're talking to you, Doctor, but they move on wheels, they're about 5 feet in tall. They have a large screen that projects the doctor's face. And they also feature cameras, microphones, speakers that allow doctors and patients to interact and talk to each other. How can you do a diagnosis on that basis?
Well, so, you know, what's important in a doctor is really what's between their ears. It's their brain, their experience, their ability to analyze a situation, not only of the patient, they got to interact with the patient's family, the local staff. And so the whole idea is to bring that remote presence of that physician by the patient's bedside and the environment of that bedside to the physician so that he or she can make the right diagnosis on how to treat the patient. And then treatment, whether it's delivering a drug or going into surgery or something like that, that can be done by people who have the hands there. But it's really the intelligence of the specialist which is really needed.
So who are your customers and how popular is this proving to be?
Well, so we're we're approaching 1,000 hospitals primarily across the United States. And the key areas of application are like in stroke care, in critical care as in patients in the ICU, in psych care, in trauma. And so our patients, our customers are any of those locations where they have these types of patients come into their doors, yet they have a difficult time getting the right specialist there quickly. And that happens all over the country and around the world.
From what I understand, you also rent out these robots for $5,000 per month. My question is, how does the Affordable Care Act impact your business? Does it help or hurt?
The Affordable Care Act, and I'm going to use the term loosely, as in healthcare reform in general, is being very helpful, because I think that the country has now reached a critical mass where people are saying categorically, okay, we got to solve this problem. We got to solve the problem of higher quality care for everybody at a lower cost. And so that's what is on everybody's mind share, and therefore this type of solution, remote presence telemedicine, is really coming to the foreground and saying, hey, this is a solution of how to do that.
Fascinating stuff. Dr. Yulun Wang of InTouch Health, thank you so much for joining us. We really appreciate it.